I frequently get contacted and asked, do varicose veins ever have to be stripped? Or do they have to be done by open surgery nowadays? The answer is no. The old surgery is dead, it is obsolete. And that's not me saying it, it's actually the literature. It's actually the medical evidence. And the best, most independent guide to that are the NICE guidelines. I'm going to show you a slide in a moment, but let me just give you a little background. The NICE guidelines is the British National Health Service independent medical survey of medical treatments. It's actually great to look up, regardless of what you're suffering from. They will tell you the independent evidence based on medical literature, what is proven, what is best. Now this slide shows the NICE guidelines for varicose vein treatment. It's dated 2013, so they're the most recent guidelines I have. You can see that the number one way to treat varicose veins nowadays is endothermal ablation. That means either endovenous laser ablation or radiofrequency ablation. The second best way to do them is ultrasound-guided foam sclerotherapy. That is not as effective as endothermal ablation, and it can have, in very rare cases, some serious complications. So it's not as good as endothermal ablation, but it's certainly an acceptable, minimally invasive way of doing varicose veins. And what the NICE guidelines say in the third line is that the old open surgical operation should only be considered when the other two treatments aren't available. Consequently, I would say that operation, in the context in which I provide care, is obsolete. And everybody should now be moving towards a minimally invasive treatment. I think ideally with radiofrequency at present. Laser is perfectly acceptable. And in the future, there may be newer treatments which come along. But right now, that is the state of the art.